Hi, this is Dr. Richard Downs with Sleep Balance Academy, and I have on the line with me today Dr. Joseph Zelk, who is a specialist in sleep medicine, and we're going to talk to you about iNAP. You start out, Joe.
Sure, sounds good. I have been interested in alternatives to CPAP for many years, oral appliances and whatnot, side sleep therapy, and I've been super impressed with a couple of these newer therapies. iNAP is one of them. It's a little handheld unit, about my size, battery powered. And it's connected to a little non-custom soft pliable mouth insert that goes in the mouth and basically pulls suction into the mouth so that your tongue and your soft palate stay in your mouth and don't get sucked and pulled back into your throat, which is what sleep apnea is. That is the opposite of CPAP, where it blows into your airway like a balloon machine. So this simply mimics what your body does every day. When you swallow, your tongue presses against the roof of your mouth. It's exactly what this feels like. So I've had a lot of questions from patients. I've had a lot of really impressive compliance with this compared to some of my other therapies. So we wanted to be able to review some of the common questions that patients had. First and foremost, it is going to make you drool a little bit at first. Take some time to get used to that. The same thing is true with oral appliances or dental appliances for sleep apnea. That does get better. If it maintains a seal, it's working for you. Thirdly, you can actually get some sensitivity in the teeth when you first use this because you're biting on it unconsciously, because a lot of bruxers actually have undiagnosed sleep apnea contributing to that. If that's sensitive for a short period of time, if it's gone within 10 or 20 or 30 minutes in the morning, that's totally normal. That'll get better. If it's bothering you longer, or if you're having any little blood forming in the receptacle, that may be something you need to talk to your dentist about. And Dr. Downs will kind of talk to you about this a little bit.
Yeah, thank you, Joe. That, if you have a acute periodontitis or gingivitis or friable gum tissue, if you haven't done a good job with cleaning and keeping oral hygiene up to optimum levels, you're going to have some blood in the saliva sometimes. It's not something to be alarmed about. It just means that you've had a problem that needs to be addressed by your dentist, and the suction did not cause the problem. It's just revealing the problem is there. Thank you, Joe. And also, you don't want to use it if you have other major dental problems like loose teeth and situations like that. Otherwise, I think it acts pretty nicely for dental purposes, especially I see, Joe, that you're wearing the aligners, and people going through expansion can use the iNAP while they're going through treatment. Isn't that right?
Yeah, a lot of my patients come to me because they had difficulty with CPAP therapy. And so now that more folks are actually doing aligners to try to get more space in the mouth, not just straighten the teeth out, expanding those arches a little bit, I needed to find an alternative because they couldn't do CPAP. So then they would be sitting there untreated while they're going through active treatment plans. The iNAP is specifically the therapy that I've been leaning on primarily for my mild, moderate, and severes. And I took that lesson from my own experience as a person who wore a dental appliance for many years for a mild case of restriction. So this is an example of an oral appliance. I couldn't go through an aligner treatment plan while being in a retainer that would limit my movement. So this has been really exciting for those offices who are actively going through aligners and want to maintain treatment of mild, moderate, and severe sleep apnea. Now, don't forget, a lot of us brucks. So like Dr. Downs was saying, if you do have some mobility and you're wearing, say, a retainer at nighttime, that could be helpful in tolerating this therapy, because retainers will keep everything kind of, situated together. And remember, sensitivity of the front teeth initially is not a problem. If it continues throughout the day or you're having an exacerbation, that needs to be assessed by your dentist. But a little bit going on for a few minutes or even up to half an hour in the morning is just you getting detrained from stopping the biting process.
Thank you, Joe. And Joe has been working with dentists for many years, more than 20 years. He's a champion of what we do and in addressing obstructive sleep apnea. And this device is approved for all stages of sleep apnea, FDA approved for mild, moderate, and severe sleep apnea. Isn't that right, Joe?
Right, that's correct. And we're having real good compliance. So glad to have this as one more tool in my toolkit.
So as a dentist, I highly recommend this device. So does Joe. And if you want to speak to us and know more about how to implement this in your office, go to sleepbalanceacademy.com and you can get a hold of Joe or I right there.
And we offer telemedicine, and it's a prescription device. So you'll need to have some testing on
Right.
file and a prescription to manage this therapy. So
Exactly. Thank you, Joe.
have a great one.
You too.